Today we're joined by Song for Charlie co-founder Ed Ternan and MLB consultant for behavioral health and addiction, Dr. Westrich, to discuss a very critical issue affecting communities across America, including around baseball. Ed, can you just tell us why you're here today?
Yeah, thanks, Lauren. Sadly, I'm here, because of a personal tragedy. In 2020, my wife Mary and I and our family lost our youngest son Charlie to a fentanyl poisoning. And what happened was that Charlie went online and got what he was told was a Percocet, which was a medication he was familiar with. He'd taken it before. He was an athlete. He'd had a back injury. But what he got was not a real Percocet. It was one of these counterfeit pressed pills, and it was made with fentanyl. And so Charlie kind of represents this new category of victim of the opioid crisis and the drug overdose crisis, where young people are vulnerable way earlier in their journey with substances because they're not looking for fentanyl, they're looking for legitimate medications, something they grew up with and familiar with, but they get these counterfeits instead, and fentanyl's so potent that oftentimes they can overdose and die very easily.
Oh, that's so tragic. I'm so sorry to hear about your loss. Dr. Westrich, what exactly is fentanyl and why are we seeing such a surge in addiction and, of course, overdose, especially among younger people such as Charlie?
Fentanyl is an enormously powerful opioid medication, like morphine, like Percocet, like heroin, actually. The difference with fentanyl is that a few grains of it can be lethal. So unlike with other medications and other drugs of abuse, there's really no margin for error. As Ed is teaching us, someone's first experience with the drug can be the one that's fatal for them.
This is obviously a personal mission for you and your family. You've been working closely with MLB and, of course, PBATS for a while. Why is this issue particularly relevant to athletes?
The support and the commitment that Major League Baseball and PBATS and the whole baseball community really have put behind this awareness effort is really impressive. It's uniquely relevant to athletes for a couple of reasons. First, athletes are under both mental stress and pressure, and they're playing and living with physical pain and discomfort, and they want to stay in the lineup. So it's this combination of high levels of stress and anxiety, accompanied sometimes by physical pain, that causes some young people to go out and seek these medications. So the trend is really that these are not party deaths. The risk is self-medication. I'm going to kind of keep it quiet, go off by myself, and either take care of my stress with a Xanax or my pain with an Oxy. And if you go out and get those pills and it's not from a legitimate source, the risk of getting fentanyl is really, really high.
And of course, that's unfortunately what happened with Charlie. Can you tell if a pill is counterfeit just by looking at it?
You really can't, and the experts can't either. Illegal drug traffickers have actually gotten their hands on the actual dyes, the stamps that legitimate pharmaceutical companies use to produce these pills. So they press them out, and they're very realistic looking. The other thing is that, in general, is that chemicals have taken over plants as the raw material of choice among illegal drug traffickers. And fentanyl, as Larry mentioned, is so potent. Being able to evenly dose the fentanyl, spread it out across a batch of pills or powders, is really, really difficult. So there's no way to test a tablet to see if it has fentanyl. I mean, you can test a tablet to see if it has fentanyl in it if you destroy it and turn it into a powder. But you can't tell how much fentanyl is in it. And if you have a batch, if you buy a bag of 10 pills, one pill might have enough to kill 5 people, one pill might have no fentanyl in it. Inconsistent dosing of this super powerful opioid makes this really unpredictable and unknowing landscape out there.
This is so scary. And Dr. Westrich, I think there are so many questions, especially nowadays, surrounding fentanyl. How exactly can it cause death?
Fentanyl causes death by causing respiratory depression. It hits the central nervous system and shuts down the breathing. And unfortunately, it can be essentially instantaneous when someone's taking a decent dosage of fentanyl. So that's why it's really only used in an operating room or in an emergency department where there are physicians standing by to resuscitate someone if they need it. Out on the street, that's not what happens.
No, it really isn't. And with all these dangers, are there any solutions here if someone does encounter fentanyl?
Yes, there's an antidote to fentanyl called naloxone, a trade name Narcan, which can be given in the nose, actually. EMTs carry it, athletic trainers in Major League Baseball carry it, physicians carry it. To my mind, it should be every place an EpiPen is and every place an AED is.
How can people identify an overdose?
When someone has a opioid overdose, they have slowed, very shallow, or even stopped breathing. Sometimes they look gray. Sometimes they have their heart stops. And if you have a question if someone has an opioid overdose, the first treatment should be Narcan, and then you need to call 911. The really wonderful thing about Narcan is that if you give it to someone and they didn't need it, you're not going to hurt them in any way.
Oh, that's great to hear. Yeah, it seems like such a scary topic in that it can be present literally anywhere if there's a pill. So, I mean, are all opioids at this point in time dangerous? How should we view these?
I think all opioids can be dangerous. They're perfectly appropriate for someone who's got a bone fracture or someone's in the hospital and needs to be treated. The important thing for all of us to understand is that if you're prescribed an opioid, it needs to be from a licensed doctor and from a licensed pharmacy, and you need to make sure about both of those things.
Ed, I've heard a lot about fentanyl test strips. Are those effective, especially when it comes to pills?
If it's okay, I'll get a little technical just for a second. Technically, fentanyl test strips do detect the presence of fentanyl in properly diluted in a liquid. So what that means when you're testing tablets is you have to crush the pill, dilute it at the right ratio, and then use the test strip to test it. There's this phenomenon called the chocolate chip cookie effect, which means that fentanyl can be unevenly distributed within an individual tablet and certainly within a batch of pills, let's say. And so you can't test shavings from a pill or break off a piece of a pill, dilute that and test it, have a negative result, and then be confident that what's left is also negative. There could be fentanyl hiding in the remainder of the pill. And if you test one pill out of a batch, you certainly can't be sure that the other pills are negative for fentanyl, because uneven mixing is really a big part of the problem. The thing with testing pills in this day and age is, number one, if it doesn't come, as we say, out of a bottle that has two names on it, yours and your doctor's, if you get it from an illegitimate source, number one, it's fake. Number two, it most likely contains fentanyl and possibly some other pretty nasty chemicals, right? And number three, the fentanyl test strips will not ever tell you how much fentanyl is in anything. So with pills, although technically fentanyl test strips work, with pills they're really not reliable. And the real useful takeaway is if anybody presents you with a tablet and says this one's been tested, that's not true. There's no such thing as a pill that's been tested.
That's really scary, Ed. Dr. Westrich, do you want to follow up on that at all?
That's exactly right. If you've taken medication, you couldn't possibly have tested beforehand. So there's no way to know what's in that pill you're taking, and there's no way to know what's in the rest of the batch.
We just had this discussion about how Narcan can be life-saving in the moment. Where can someone acquire Narcan?
In most states, Narcan is available over the counter at pharmacies. In many states, it's actually free. They're giving it out. So there's no reason not to have that in your purse or your knapsack or your glove compartment in case you need it. I would also add about Narcan that it's important if you decide to give someone Narcan and you resuscitate them that you also call 911 and be prepared to give a second dosage, because sometimes the opioid is so powerful that you need a couple of dosages.
Oh, wow.
The other thing is that Narcan isn't treatment. It'll save somebody's life, but there is treatment available for the addiction to opioids, which someone can access after they've had their life saved by Narcan.
So in the moment, that's almost like CPR, but if you really want to address the addiction, you need to go see a specialist.
Exactly.
That makes complete sense. From just a behavioral standpoint, how would you be able to tell if someone you know or love has an issue with opioid addiction?
From my perspective, if someone is impaired in their work or their school or their relationships because of a substance, then they have a problem. Also, I would say if you feel yourself craving a medication, if you feel you find yourself going outside of the usual pathways like your doctor to get a medication, that should be a red light for you.
Okay, so if you identify that someone does have a problem with opioids, then what should you do for that person that you obviously care tremendously about?
If you care about someone, you can tell them, I'm concerned about you, I'm worried about you, I can help you get some help for this. And getting some help actually at this point is relatively easy. Any healthcare provider can either help you with the addiction or get you to a place where you get the addiction treated. And really the important thing is to take that first step and then stick with it. Sometimes addictions are not so easily treated, but they are very treatable. In my practice, I've seen many, many people get better from opioid addictions and other addictions.
Oh, that's really great to hear. Just such an optimistic outlook. And Ed, obviously, we want to thank you for coming and just bringing more attention to this crisis. In your opinion, what would you like viewers and athletes to take away from this conversation?
The hopeful thing is that many young people are dying because they lack information. They don't understand the risk. And so the good news is that just by informing players and fans, we can really reduce risk and save lives. We'd love to have everyone in the Major League Baseball community get involved and learn and share. Learn about what's going on. And just by sharing with your friend group that you can't trust any pill that doesn't come from your doctor really can make an impact on this national crisis. We have a saying, just no random pills. It's very simple. It's 3 words like look both ways before you cross the street. No random pills. If we spread that word everywhere, I think we can really make a dent in this.
Ed, so much of this topic has been surrounding Major League Baseball and, of course, professional sports, but how is this relevant, especially for parents in particular, when it comes to their youth athletes?
It's a great question. It's an important conversation to have in the home and to start at a pretty early age. And the reason is that what's new about the problem is that illegal drug traffickers are producing and distributing pills that look just like medications that young people are pretty familiar with, and they're comfortable taking them, and in today's culture, comfortable even sharing them. Pills like oxycodone that they might get for their wisdom teeth, or Xanax they might be prescribed for anxiety. Percocet's a popular one on the street, and also Adderall, so counterfeit Adderall.
Wow.
Fentanyl has been found in counterfeit Adderall, which also very often contains methamphetamine. The drug landscape has undergone this radical change in a couple of ways. The raw materials have changed from being plant-based to being mostly these very potent chemicals, opioid chemicals. That and the idea of marking them to look familiar to young people, to disguise them as medications, that makes this a completely different landscape. And the way I describe it is when I was growing up, I was warned about drugs and taught about drugs in the context of like a journey or a pathway, where I would grow up, I'd be exposed to some things as I got older, and the risk was that if I took too much too often, I might become dependent or addicted, and one day accidentally overdose on my drug of choice. So it was like a pathway. Today, the drug landscape is way more like a minefield, where for young people today, the first or second step out there might be their last, because the supply is full of stuff that looks familiar, but is actually very potent and unevenly dosed and unpredictable. So it's extremely risky. So for parents to learn about that and start having that discussion amongst family members, it's important to get that going.
It's a very apt and scary analogy. Dr. Westrich, when is it appropriate to talk to your children about this issue?
Well, to Ed's point, since the downside is so steep of making a mistake, I would say long before middle school. And parents need to find an age-appropriate way to talk to their child about how they're going to address any medications or drugs or substances that they're offered. In the same way we teach our kids about looking both ways when they cross the street or putting on the seatbelt every time. You have to find a way to do that when they're at a very young age, and then continue having the conversation as the child gets older in a more sophisticated way, but making sure they understand the potential lethality of making a mistake.
Ed, before we say goodbye, and again, thank you so much for being so vulnerable and sharing your story and imparting all this wisdom on everyone watching. Where can people get more information?
Well, at Song for Charlie, we've created a whole suite of resources just based on our belief that we can have a real impact on this problem just by informing people. So we have a lot of social media posts. People can follow us on social. A lot of that content is for younger audiences, but also some for families as well. We have resources for parents. We have a video for parents called The New Drug Talk, which kind of informs them and brings them up to speed about what's changed with the new chemical drug landscape. And we have resources for schools and educators that they can use either for school assemblies or in the classroom. So songforcharlie.org is our website, and you'll find a whole suite of resources there.
And is there a number people can call if they need help?
Well, there's always the 988 hotline, which is really important. I think these new mortality, the deaths that we're seeing are often more self-medication than partying. As Larry's alluding to, what's very risky now is to kind of isolate and self-medicate for either mental or physical pain. And asking for help is actually the right thing to do. That's the most important thing to do. It's sometimes difficult, but the alternative, locking yourself away, not telling anybody that you're hurting and taking a pill or even a powder is really, really dangerous these days.
Well, gentlemen, thank you so much for both sharing your expertise and, of course, being vulnerable and sharing your story, Ed.
Thank you, Lauren. And thank you, Dr. Westrich.
Thank you both.